and Sean Bogenrief started their life together with dreams of one day becoming parents. But challenges awaited the young couple when Anne began experiencing serious complications late in her pregnancy.
32 weeks pregnant, and it came as a huge shock. I guess we were thrilled to finally be expecting a baby, and this was the last thing we ever anticipated happening.
They spun me into the emergency room, into a gown, and they were just taking the first slice.
It was shocking. However, everything seemed to go so fast. It was kind of an out-of-body experience, happened very quickly, and it was very frightening.
An emergency C-section delivered a daughter they named Catie.
2 pounds, 10 ounces. And no more than the size of a football in length. Probably weighing about what a football does. But I think with maybe it being your first, and this certainly for us, and we've said it countless number of times, that we didn't know enough to be as afraid as we should have been.
The first 48 hours were crucial for both mom and daughter. Then, tiny Catie couldn't pass her meconium, signaling an intestinal blockage.
It's basically lodged in her intestinal tract, and that the hospital where she was born was unable to give her appropriate care. And at that time, we were told that she was going to be transported to Children's Hospital.
And you're thinking, this tiny little baby, how can they operate? Is it going to be okay?
A nervous young father was by Catie's side as she was rushed to Columbus Children's for a life-saving surgery. Then, the premature baby was monitored carefully in the intensive care unit. Catie was a fragile 5-day-old infant when a scared young mother left her own hospital bed to sit at the bedside of her daughter.
She was under the Billy lights and therefore had a little mask over her eyes. And she had countless tubes coming in and out of her body. But the nurse was wonderful. I acted like I am right now. And the nurse said, Mom, she can sense your fear. So go away and collect yourself and come back when you can show her the strength.
Anne and Sean drew strength from the exceptional family-centered care at Columbus Children's. They found comfort in the care being given to their Catie.
Well, we were welcome there 24 hours a day. Not that they could have kept us away, but I think they know what families and parents go through.
The staff is so patient and family-oriented. And I think in other institutions you find them to be patient-oriented. And the family is sort of, in some cases, in the way or a nuisance. And that is not at all the feeling that you have at Children's Hospital.
Spending weeks witnessing what happens inside the walls of Columbus Children's Hospital, the Bogenriefs discovered an incredible world where miracles seem to happen every day.
There's far other more miraculous things, I think, that go on there on a daily basis. You can't have an appreciation for what goes on there. You just can't.
As Catie grew in size and strength, her parents hoped for the day they could take her home.
And I'll never forget, Dr. Gary Snyder asked us to meet him there, so we kind of knew something was up. But it was Mother's Day, May 10th of that year, and he left his own family to come in and see Catie go home. It was awesome. It meant an extreme amount.
So Anne and Sean bundled up a 4-pound, 3-ounce Catie and headed for home. Even today, it's hard to express their gratitude to Columbus Children's Hospital.
I think we have to remember to say thank you. It wasn't just then.
We certainly didn't expect things to go the way that they did, but it certainly has been a glorious outcome.